If you're over 70 and using acetylsalicylic acid, you might be making some very common yet avoidable mistakes. Many people in their 60s, 70s, and beyond assume that because they've always done it this way, there's no reason to change. However, our needs, bodies, and overall health picture evolve with each passing year, and what worked well at 55 could pose new risks or offer diminished benefits at 75. It's not about scaring anyone or claiming that medications are bad. It's about shining a light on how we can be smarter, safer, and more informed so we can feel our best and maintain our independence. Even if you've taken acetylsalicylic acid for decades, there's a good chance you aren't fully aware of the pitfalls that can arise if you continue taking it without a thorough check-in on dosage, frequency, and interactions. Staying proactive about how you manage any medication is essential to maintaining a healthy lifestyle in your later years. The challenge is that many seniors were given information about acetylsalicylic acid, often referred to by its popular brand names, decades ago. Information that might be outdated now. This matters because the cumulative effect of medication in an older body can differ drastically from that in younger adults. Beyond that, new research, new medications, and new health conditions can change how any single medication behaves in your system. By addressing these issues, you have the potential to lower your risk of side effects, avoid unnecessary complications, and live each day with greater peace of mind. In a moment, we'll explore 5 common mistakes seniors make with acetylsalicylic acid use after 70. We'll touch on dosage, interactions with other medications, how consistently or inconsistently it's being taken, the importance of reviewing your regimen with a healthcare provider, and how to store your medication properly. By the end of this discussion, you'll have practical steps you can take to fine-tune how you manage and monitor your acetylsalicylic acid intake. You'll discover that making even modest changes can lead to a significant difference in how you feel day to day and how confident you feel about your long-term health. I've spent years talking with older adults about medication best practices, drawing upon what pharmacists, geriatricians, and credible health resources generally recommend for the 65-plus population. While I'm not here to override any medical advice you've received, I can share valuable guidelines, common oversights, and methods for smarter self-management. If you're watching this, I encourage you to listen with a curious mind and reflect on your own daily habits and beliefs about acetylsalicylic acid. Do any of these sound like you or someone you know? Sometimes one small shift in how you take your medication can spare you a great deal of discomfort later on. Let's dive into the first of 5 mistakes. It might surprise you to learn how often seniors do this without even realizing it. As you listen, feel free to jot down any questions or observations. Then once we're finished, you might decide to have a conversation with your healthcare provider or even a close family member who helps you manage your medications. Because in the end, taking control of your own health is one of the best ways to maintain your independence, confidence, and vitality, no matter your age. Mistake number 1 is sticking to the same dose of acetylsalicylic acid you've had for years, regardless of how your health situation has changed. Many older adults continue taking the exact same regimen they started in their 50s or 60s, convinced that a single dose recommendation is universally applicable. That assumption can be risky. Take Jim, for example, who's 74 now. In his mid-50s, Jim's doctor suggested a daily low-dose acetylsalicylic acid to help reduce certain cardiovascular risks. It was good advice at the time, so Jim simply followed instructions every single day for nearly 2 decades. In many ways, he's proud of his consistency, but he never considered the possibility that his needs might have changed. Over the years, Jim developed a few more health issues, joint problems, elevated blood pressure, and eventually type 2 diabetes. None of these conditions in isolation raised a red flag for him about his acetylsalicylic acid use. He also began taking multiple new medications, including blood thinners. Because the topic rarely came up during his quick annual visits, Jim never thought to ask his doctor whether he needed to adjust his acetylsalicylic acid dose. Then one day he noticed unusual bruising on his arms and a persistent upset stomach. He chalked it up to aging and tried to ignore it. But during a routine checkup, his physician discovered that these new symptoms were likely tied to how his daily acetylsalicylic acid and other medications were interacting in his now older, more complex body. What changed? Quite simply, Jim's overall health landscape had evolved. The same dosage that was appropriate for his 55-year-old, relatively uncomplicated system might no longer be ideal. Research also shifts over time, and some recommendations for low-dose regimens have become more nuanced for older adults who might be at increased risk for internal bleeding or other complications. The evidence-based insight is that any medication regimen should be periodically reviewed, especially as new health conditions emerge. For acetylsalicylic acid, this might mean adjusting from a daily schedule to something else, or possibly discontinuing under medical supervision if the risk outweighs the benefit. The practical, actionable step here is to schedule a medication review with a healthcare provider at least once a year. Bring a list of all your meds, vitamins, and supplements. Even better, share a simple log of any side effects, bruising, or digestive troubles you've noticed. This conversation can help clarify the correct dosage, or whether you need acetylsalicylic acid at all. The physical benefit of doing this is that you reduce your chance of serious side effects and ensure you're taking exactly what your current health situation calls for. The emotional benefit is peace of mind. You no longer have to worry about hidden side effects or second-guess whether you're doing the right thing by sticking to an old routine. You'll be more in control of your health, and that sense of control is priceless. Before we move on to the second mistake, take a moment to think about your dosage. Have you updated it over the past decade? Do you know if it's still appropriate for you? If you're not entirely sure, make a note to bring it up at your next doctor's appointment. It's a small step that can make a big difference. Mistake number 2 is neglecting the possibility of interactions between acetylsalicylic acid and other medications or supplements. Some people figure it's just a mild over-the-counter pill, so it can't possibly interact with my prescription meds or vitamins. But in reality, even everyday substances can change how effectively your medication works or increase your risk of side effects. Consider Lila, who is 78 and proud to be managing a handful of conditions with minimal issues. She takes a blood pressure pill, a cholesterol medication, a daily vitamin D supplement, and something for occasional acid reflux. At some point, a friend recommended a joint health supplement that included certain herbal extracts like turmeric and ginger. Eager to maintain her mobility, Lila added that supplement to her daily routine. She continued her daily acetylsalicylic acid as well, never suspecting a potential conflict. Over time, Lila started experiencing more frequent bouts of heartburn and noticed that the smallest bruise would stick around for weeks. She wrote it off as normal aging. However, a casual remark at the pharmacy about her new supplement revealed that the herbs in that product might have a blood-thinning effect, which combined with acetylsalicylic acid was increasing her bruising. The acid reflux medication was also interfering with the absorption of certain nutrients, adding another layer to the puzzle. The more each piece stacked up, the more complicated it became for Lila's body to maintain balance. The critical insight here is that anytime you add a new pill, prescription, over-the-counter, or herbal, there's a potential for interaction. You don't need to become fearful or avoid any new treatment, but you do need to remain proactive about letting your doctor or pharmacist know everything you're taking. Sometimes just spacing out when you take certain drugs can help, or changing the dosage of one or more items to keep everything in harmony. The physical benefit of avoiding harmful interactions is that you reduce the risk of everything from gastrointestinal issues to more serious complications like excessive bleeding. Emotionally, it can spare you the anxiety of unexplained symptoms and give you the confidence that you're truly taking your medications the right way. If you're like Lila and you've recently added any supplement, be it a multivitamin or something more specialized like turmeric capsules, pause and reflect on whether you've discussed it with a healthcare professional. Are you noticing new or unexpected symptoms that might be related to it? It's natural to assume that because it's sold over the counter, it must be harmless. But in seniors, especially those on multiple meds, harmless can be quite relative. Mistake number 3 is taking acetylsalicylic acid inconsistently, then doubling up if you've missed a dose. Many seniors do this thinking, well, I forgot to take my pill yesterday, so I'll just take an extra one today. They might also fluctuate between taking it every day and taking it every other day, depending on how they feel. The problem is, irregular dosing can throw your body's balance off, making it harder to predict how the medication will affect you. Jim, who we mentioned before, actually never missed a dose. But let's introduce you to Carol, who's 76 and relatively forgetful when it comes to her medication routine. She means well, but between her volunteer work, grandchildren's visits, and her daily chores, sometimes the pill just slips her mind. So she figures if she realizes she missed it, taking 2 the next day will make up for lost time. Over several weeks, she notices sudden headaches and slight dizziness, but she doesn't connect the dots right away. Finally, after feeling unusually dizzy while gardening, Carol checks in with her pharmacist. She learns that playing catch-up by doubling her dose can spike the level of acetylsalicylic acid in her bloodstream, increasing her risk for bleeding and other side effects. And taking it erratically might be less beneficial than she thinks, because some of the protective effects she's relying on, be it heart health or something else, may not be consistent if the dose is constantly changing. Evidence shows that consistency is key with many types of medication, and acetylsalicylic acid is no exception. A stable daily routine helps maintain the therapeutic level of the drug, if that's indeed what your doctor has recommended. The actionable tip here is to implement a reliable reminder system. Some people use pill organizers labeled by day of the week. Others set an alarm on their phone or place a sticky note on the bathroom mirror. If you do miss a dose, check with your doctor or pharmacist rather than self-adjusting the dosage. This approach reduces the physical risk of overdosing or underdosing, which can have serious consequences as we age. Emotionally, it helps you feel more in control and less worried about whether you're doing it wrong. And it reinforces that you have a say in your health. By creating a simple routine that fits your life, you reduce the need for last-minute guesses. If you've ever found yourself rummaging through your pill bottles thinking, did I take it or not? You're not alone. One quick solution might be writing down each dose as you take it. It might feel like a hassle at first, but it's simpler than dealing with complications later. Or, if pen and paper aren't for you, perhaps there's a family member who can double-check your organizer weekly, especially if you struggle with memory. Let's pause here and reflect. Have you ever doubled up on a medication because you forgot a previous dose? It's a common practice, but definitely worth reconsidering. If you have any personal experiences to share or tips you found helpful, I'd love to hear about them. This kind of open dialogue can help us all learn from one another. Mistake number 4 is failing to store acetylsalicylic acid in optimal conditions. This might seem trivial, but medication storage plays a big role in how effective or how safe a medication remains. Many people keep their medications in the bathroom cabinet, which is prone to heat and humidity. Others leave them on a kitchen counter, close to a stove or window. Over time, these environmental factors can degrade the active ingredients in your pills, leading either to reduced potency or unexpected changes in how your body reacts. Francine, at 72, started noticing that her acetylsalicylic acid tablets smelled a bit off. She'd been buying a large bottle to save money, and it would sometimes last her over a year. Because she kept it in the bathroom, the bottle was constantly exposed to steam from showers and fluctuations in temperature. After a while, she realized the pills were partially discolored. A pharmacist confirmed that, while they might not be immediately harmful, the potency could be compromised, and that's not something you want to gamble with if you're relying on the medication for certain protective benefits. The evidence-based recommendation is to store acetylsalicylic acid in a cool, dry place, somewhere in your home that doesn't encounter frequent temperature swings or moisture. Keep it in its original container with a tightly closed lid, and always check the expiration date. If you have a large bottle that you've been using for months on end, pay attention to any changes in smell, color, or texture. When in doubt, ask a pharmacist whether it's still safe to use. Practically speaking, you can choose a drawer in your bedroom or hallway cabinet away from the bathroom humidity. You might also consider buying smaller bottles so you use them up within a shorter time frame. The physical benefit of correct storage is that you're more likely to get the actual dosage the bottle says you're taking. If the medication degrades, you might unknowingly be taking less or more than you think. The emotional benefit is knowing you're using your medications properly, which reduces the worry that something as simple as where you keep the bottle could compromise your health. One simple step today could be going through your medicine shelf. Look at where you store everything, including your other prescriptions and over-the-counter items. If any are in warm, humid spots or well beyond their expiration dates, discard them responsibly. You'll feel a sense of relief just knowing everything is in proper order. Finally, mistake number 5 is not having regular check-ins with a healthcare provider to see whether you still need acetylsalicylic acid at all. This can be a tricky topic because for years, many doctors advise people in middle age to start taking a low-dose tablet daily for heart health. But guidelines have evolved, and for older adults, especially those over 70, the benefits and risks can shift significantly based on new research and personal health status. Take Manny, who's 80 now. He started on acetylsalicylic acid after a minor heart concern in his late 60s. For a while, it seemed to be helping. His blood pressure and cholesterol were relatively stable. As the years went by, Manny developed a few kidney issues and began noticing that even minor cuts took a very long time to stop bleeding. At an annual visit, a new specialist mentioned that for someone with Manny's profile, the daily acetylsalicylic acid might no longer be necessary and could in fact elevate his risk of bleeding complications. This was news to Manny, who'd thought the medication was a lifelong must. The reality is, just because a medication was once recommended doesn't mean it's forever. Our bodies change, our risk factors evolve, and medical guidelines shift as new evidence comes to light. The best practice is to have an annual medication review, sometimes called a brown bag checkup, where you literally bring all your medications to the appointment. Go through them one by one with your healthcare provider or a clinical pharmacist. Ask, do I still need this? Has any recent research changed the recommendation for someone my age and health status? The benefit? Physically, you may reduce unnecessary risks. If your body no longer needs acetylsalicylic acid, stopping it under a doctor's supervision could spare you side effects like internal bleeding or severe gastrointestinal distress. Emotionally, you gain clarity and confidence about what you truly need to stay healthy. There's something liberating about clearing out medications that no longer serve you, or at least adjusting them for where you are in your health journey now. As you think about this final point, ask yourself, when was the last time you sat down with your doctor or a pharmacist and really discussed every single medication in your regimen? If you can't recall, that might be your sign to schedule a review soon. No matter how busy the doctor's office is, you have the right to ask for that time. You deserve clarity about what you're putting into your body and why. Now let's quickly recap the 5 mistakes we've discussed so you can keep them at the forefront of your mind. First, using the same dose year after year without reevaluation. Second, neglecting the possibility of interactions with other meds or supplements. Third, taking acetylsalicylic acid inconsistently and doubling up on missed doses. Fourth, storing your medication improperly in places like the bathroom or near extreme temperatures. And lastly, forgetting to regularly check with a healthcare professional to confirm you even need the medication at all. There's no need to feel bad if you've recognized yourself in these examples. The purpose here is not to criticize, but to highlight steps you can take right now to optimize your health. Taking any medication, even something as familiar as acetylsalicylic acid, demands the same kind of respect and vigilance you'd give to a brand new drug. Our golden years often bring new joys and experiences, but they also bring more nuance to our health. By staying one step ahead, you empower yourself to live more comfortably and confidently. That said, it's important not to panic. Urgency doesn't mean alarm. It means it's wise to take action sooner rather than later. If any of these points raised red flags for you, schedule that medication review, have that conversation with your pharmacist, or start using a pill organizer if you haven't already. Small steps can have a big impact over time. Picture how your life might look if you implement these changes. Imagine the peace of mind you'll have knowing your medication routine is exactly what your current health status calls for, that there's no unknown risk of dangerous interactions, and that you're working in sync with your healthcare team. You might find yourself with fewer unexplained aches or bruises, more confidence in your day-to-day activities, and a deeper sense of ease that comes from doing what's best for your body. If you're ready for the next steps, there are plenty of ways to move forward depending on your comfort level. At the simplest level, you could start by checking your medicine storage and verifying expiration dates. If you want more guidance, you could bring a written list of all your meds to your pharmacist and ask for a quick consultation. For those seeking a deeper dive, book an extended appointment with your primary care doctor or a geriatric specialist for a thorough medication review. If you're active online, you could also join community forums where other seniors discuss safe medication practices. Just remember to verify information with qualified professionals. No matter which path you take, you're in the driver's seat. Seniors today have access to more information, resources, and innovative tools than ever before. You don't have to settle for outdated instructions or silent frustration over side effects. By staying informed and empowered, you can continue to write your own story in your 70s, 80s, and beyond. After all, a little bit of caution and curiosity now can help protect the health and happiness that you deserve to enjoy for years to come. Thank you so much for watching and listening. If you found any of this helpful, consider sharing it with a friend or family member who might also benefit. It's often in the small tips and stories that we learn the most, and together we can create a supportive community of older adults who take charge of their well-being. Here's to wiser, safer, and more proactive medication practices in a future where you continue to live life on your own terms.